You're listening to episode 182, Virtual ChildLife Services in the Hospital. Hello, my friends. Welcome to ChildLife on Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here. Hello, my friends. I'm so happy that you're here today with us. It's an exciting day because I get to share with you Sarah Lanham, who is a certified child life specialist working at Helen DeVos Children's Hospital, and she is doing something outside of the box. I have never gotten to interview someone who is doing child life services like she is, and I doubt many of us have even seen how this really plays out in children's hospitals, and I'm talking all about virtual services. So she actually doesn't see patients face to face. She sees them via phone calls and FaceTime and Zoom appointments and all of that good stuff. If you are just joining us for the first time and you don't know what a child life specialist is, that's okay. You're still welcome here. We work in hospitals, healthcare settings, and community settings and help kids and families cope with diagnosis, illness, treatment, challenging life events, and overall how child development plays into coping skills and psychosocial care. So we're so happy that you're here, whether you're a parent or a professional or just really curious about how Sarah is operating in a hospital system in a virtual capacity. I mean, it's really exciting stuff. So let's go ahead and get started with our conversation. It's always fun for me to have another child life specialist on the podcast. I just got done with another interview with a mom, and she was literally speechless about what child life and, in their case, canine therapy did for them, and just that it totally changed everything. And I was like, I hope you tell your child life specialist that, because we don't always get to hear those types of things. So I'm telling you, and I'm saying thank you for doing what you're doing. But please tell us a little bit about you. Give us your name, your background, all that good stuff.
Yeah. So my name is Sarah Lanham. I am a certified child life specialist here in Grand Rapids, Michigan. I work at Helen DeVos Children's Hospital, and I am actually a virtual child life specialist. So I am doing virtual visits with kiddos coming in even before anything that they have done at the hospital or inpatient or outpatient. So yeah.
That's amazing. How did you transition into this role? And have you always been virtual? Did you help like make it happen? How did you get,
Yeah.
because this hasn't caught on at a lot of hospitals yet.
No, no. So COVID hit and our hospital had to downsize our child life program. And so I was working at the time as a child life assistant here, got laid off, and it was actually the perfect timing because I was able to do my practicum and internship during that time. And then kind of in the background, when I was doing all that, they started this virtual program and they were just doing it, kids coming in before surgery, just because, we have those pre-surgical tours that families were able to come in. And when COVID hit, it was like, what do we do now? And so it felt easy for them to be like, yeah, we'll do virtual. But I think a lot of hospitals were doing the same thing. So once we kind of started it, which I wasn't involved in starting it, once they started it, they kind of just clicked, and they had more and more, and then they tried to get funding for an actual position, and they did. And so by that time I was working PRN at Helen DeVos. So I'd come back, I was working PRN, wanting full time, and this position opened up, and it kind of just fell into my lap. So it's been fun to kind of grow the program, because like you said, like there's not a lot of hospitals. I know Mayo just had one get approved, the position, but other than that, there's not any. I haven't really talked to a ton. I've talk to you obviously about just doing virtual visits with families,
Yeah.
but it's so new and it's hard, but it's also so rewarding.
Yeah. Well, it's just a whole new twist and outlet where
Yeah.
child life can grow into. And I have to say, like, totally applaud your hospital, Helen DeVos, for saying yes, being open to trying something new, and then realizing how important and necessary it is.
Yeah. Yeah. It's been really cool to see the hospital grasp onto it too.
Yeah.
And even families are just like, "Oh my gosh, like that would be so helpful." And, them being able to do it from their home, a place where their child feels comfortable, and in their safe space talking about something that, could be scary for them and that they've never done before. So that's been really cool too, because I had never done an actual pre-surgical tour. So I don't really know how that went, but I mean, it's a lot to come to the hospital, do a tour, and then, "Oh, just kidding, you're not having surgery today. We're
Right.
going to come back." And then potentially they could be like, "No way, I don't want to come back." So having them in their safe space has been really cool. And I've gotten a lot of good feedback from parents about it too.
It just virtual removes barriers and it improves access for more families.
Absolutely.
And those are just two non-negotiable important things for
Yeah,
families to feel safe.
absolutely.
So talk to us about your process and your job and what it looks like. And you've talked about like what a pre-surgical tour is. Tell us what you do as a part of your job every day.
Yeah. So, since we're kind of still in the beginning parts of it, I say beginning, but it's been almost a year since I've taken over this role. And so there's a lot of behind the scenes, but I'm still doing some cold calling. So usually in the mornings, I will get my list together of, the people that I need to cold call that day to offer a pre-surgical tour. I do pre-surgical tours. I also do our outpatient surgery centers. I do radiology and sedation, so I'll do those tours. I have just jumped into the cardio clinic, which has been really, really cool, and then also the burn clinic. So I'm offering, whenever someone comes in. So I'll look at those schedules about 2 weeks out, decide, 2 weeks out from today, these are the kids that are coming in that would be appropriate. I usually shoot for 2 to like 15-ish. Obviously, there's exceptions and everything. So I'll build that list and then I'll call families. When I do get a hold of them, we will set a time to meet with me. We'll set that time. And then, yeah, so it's usually that's in the mornings. In the afternoons, it's more a lot of visits. So that looks like I have a presentation that I have pictures of our hospital from, this is where you park. This is, you walk across our bridge. This is our front desk. This is the elevator you'll go
Wow.
down. So it's like showing them actual spaces that they will see and walking them through the day, for surgery if they're going to get an IV before surgery. I know a lot of families are worried about their kid getting an IV, and I'm like, well, they won't get it until they're asleep. So that, can take a lot of pressure off of the day too. So the visits are usually a half hour ish. So kind of walking through the day, and then answering any questions that they have. It's geared like way towards the kids, but I've done it just for parents too. I know a lot of like 2-year-old parents are like, my kid won't really sit still for this whole thing, but I'm really nervous too. And so I'll absolutely do that for them too.
Wow. What if your child life or clinician counterparts in the surgical or radiology or wherever the
Mhm.
patient is going to, what have they said in their opinion about this new service that you've offering? How are
Yeah.
families coming in?
Yeah. It's actually been really cool. I'll like walk in our surgery center and they're like, "You're so popular," because they'll come in and they're like, "Well, I know I'm going to color my mask and I'm going to put on my hospital gown and you have to do vitals." And they're like, "Whoa, like this is so not like we are so not used to this." So, but it's also awesome to hear that just because they feel like they're in control. They know exactly what the day is going to bring. So, almost teaching the nurses and staff there is just, it's really cool. I don't feel like sometimes, kids don't really grasp what you're saying, but it's really cool when they do come in and say, like, this is what I'm doing. They really understood and listened and heard what we were talking about.
How huge that kids
Yeah.
feel empowered enough to come in and be like, all right, let's get
I
vitals done.
know, I'm ready.
That's just amazing. Tell me more about kind of the process when you're in a virtual visit, because we know that sometimes things can come up and that looks like tech issues. It looks
Yep.
like 10 minutes of just getting the child comfortable with
Yep.
you, a child who doesn't want to speak back to you. How do you handle
Yeah.
those challenges?
Yeah. So it's generally, so we do it on we have Epic, so we do it on telemed calls. When I talk to the family, I'll make sure that they're comfortable with it. If they're not, I'll do like a Teams call if it's easier for them. But in terms of making sure the patient's comfortable, it's just kind of jumping in, talking to that patient. I usually start it like, "Oh, your name is this?" And they're like, "Yeah." Like, "How did you know?" And so then just like asking how their day is, "Did you play outside today?" Just starting it like that, just a normal conversation instead of jumping into, "You're coming to the hospital." And so building that rapport with them even before we jump in. If they're so like shy, which I've had shy ones, I'm like, "I'm going to show mom these pictures. And if you want to, sit next to mom, you are more than welcome to. Mom can ask me some questions." And then they generally will be like, "No, I want to be involved too." So,
So, what I
yeah.
hear is it's not any different than what we do
Nope.
in real life.
Nope. Except they're not right next to you.
Yeah.
Yeah.
And they're a little bit more in control,
Yeah.
right? Because
Absolutely.
when you're with a child in a small room, they can't get up and walk away.
Mhm.
But if they're overwhelmed, they actually have the autonomy to get up and do that or,
Right.
give you cues and signals. And it's really amazing.
Yeah. Yeah. It's really cool. Just even, I always talk about for pre-surgical tours, like, you can bring a stuffy if you want or a blanket, your favorite blanket. And then they always get up and they're like, "Oh, I'll go get mine and show me,"
Yes.
and so it's like, they're understanding, they're showing me what they're gonna bring, and they're almost excited about it too.
Have staff found that families are coming in less anxious, less fearful? Or have you gotten any reports or tracking about that?
Yeah, so I've gotten actually more referrals from, people come in and they're saying, "We actually had a virtual visit and it was super helpful." And so they're like, "Okay, wait, how do we refer families so that more families can get it?" So I think coming in, they're definitely less anxious, but then staff are way on board and they're like, "All right, we need more visits before because it goes so much smoother."
Yeah. And wow, that's amazing. What has been your favorite part of being the virtual visit child life specialist?
I think my favorite part is when they come in and they're like, "Where's Miss Sarah?" And I'm like, "I just do this." But then they like tell the specialist that works in surgery or radiology sedation, they're like, "This is what we did. And it was so cool." He or she was so nervous, didn't even want to talk about coming to the hospital. And, afterwards, they wanted to tell all their siblings about it and went to school and talked about it. And so just like not knowing how much of an impact you're making, but like it's such an impact. So I think that's my favorite part of just like hearing the praises of like this simple thing that like this is what I would love to do. So, it's so easy for me, but it can make such a difference in a child's
Wow. And are you charting on these interactions? And
life.
how do you guys do that handoff if you get some information from a family that this is a really big trigger or they have
Mhm.
sensory preferences? How does that handoff work?
Yeah, so I chart on every patient that I see. So anyone who is seeing them also can see that I saw them. But if there is something very, important, a family situation or something that I want to make sure that they know, I will send them a message directly. The specialist that works in that area, just, "Hey, I had a virtual visit with them. They brought up this. I just wanted you to be aware." And so it's a constant, I'm constantly sending it to them and I'm like, "Is that too much? Like, am I," and they're like, "No, like we need all the information we can get." And it's also in the chart, but it's different when you're getting a message just to you with stuff that just you need to know too. I think the handoff's going really well. I think the specialists have said that it has helped their interactions too, because they know what they're walking into.
Yeah. Just so impactful for the families, but such a a time saver when
Mhm.
we work in a world where we have way more patients than we do child life
Yep.
specialists.
Yep. Yes.
One of my favorite questions is to ask if you had a magic wand and you could do anything in terms of your position, what would you do?
I I would have more of me just so that we can reach more people. I have this list of, departments that I try to cover, but, I don't want to bite off more than I can chew. And so, if that looks like, could I do virtual visits for, siblings that have siblings in the NICU? Can I do more in the outpatient setting in like ortho, stuff like that? And I don't have the time in a day to be able to do all that. And so I think more of this position would be amazing for our hospital. I think all hospitals need a virtual visit child life specialist. I think it's super helpful.
Wow. And my last question is, how does the cold calling and transition into actually scheduling a meeting? Do you know what like that success rate is between you reaching out and actually having the visit completed?
Yeah. So I've actually had more success with emailing. And I think just in our day and age, like if I get a call from a number I don't know, I'm not going to answer it.
Same.
Right. And, even if they leave a voicemail, I'm like, okay, like, do I want to do it? Do I not? I have to call them back. And so I feel like emailing has been a lot more successful just because, you get an email and you're like, oh my gosh, yeah, that's so, and then you can respond whenever you want after the kids go to bed and, not in the middle of your work day. So that has been, I feel like that's been very successful. I think going through Epic, they get all the reminders. It's just like a normal appointment too. So they're getting
Right.
the reminders like it's one day until your visit. And so I mean, I would say 90% of my visits show up just because they get those reminders and everything. It hasn't always been that way. We've been doing it. They started doing it just on Teams. And I think there was more people not showing up just because, like you didn't put in your calendar, you kind of forget about it. You're not getting those reminders. So technology is amazing.
That's incredible. Well,
Yeah.
thank you for doing what you do, for saying yes to
Yeah.
something new, being open to learn and sharing it with so many people. And
Yeah.
I can't wait to see what you continue to discover.
I'm
Thank you so
excited.
much.
Of
Yeah.
course.
Thank you all so much for listening to Child Life on Call. If you head to our website, childlifeoncall.com, you're going to find all sorts of stuff there for parents, professionals, healthcare providers, child life specialists, no matter who you are. Actually, when you just go to our homepage, it'll help you direct to exactly where you need to go. On that, you'll find opportunities and PDUs for child life specialists. Parents, we've got a starter kit for you. And clinicians, we even have a clinician course, which teaches you how to be a confident and capable caregiver in pediatrics. We're so grateful that you're here. Please DM us on Instagram. And like I mentioned, when you rate and review this podcast, it helps other families be able to find us. So let's keep doing that. And I will see you again here next week.